Welcome back to News 3 Today at 11. WSAV continues to celebrate Women's History Month. This morning, our focus is on Black women in medicine, particularly the achievements of surgeons. Currently, less than 1% of Black females make up practicing surgeons in the United States. Dr. Saudia McCarley is one of them, and she is right here in our area. Thank you so much for being here today.
Thank you for having me.
First off, let's talk about your journey, because you were born and raised in New York. Well, you were born in New York, Buffalo, moved to Virginia Beach where you were raised, and then what happened?
Well, my story actually starts when I was 6 years old. Unfortunately, I was attacked by two Rottweilers.
Oh, wow.
And so I had multiple surgeries during that time. Coincidentally, I had a dog at the time, so I didn't have a fear of dogs, but that dog I had since I was 4 years old, and I loved her so much I wanted to be her doctor. So Virginia Beach had unique opportunities in that they had academies at the high schools, and so I applied for the Health Sciences Academy and got in. While I was there, I had an incident where I had some swelling of my face, and I was referred to a plastic surgeon. And following all those surgeries I had as a young child, I was told that they would be able to fix my eyebrow, which was disfigured at the time. And so once he did that, it really changed my life and really made me want to go into surgery particularly.
Now, after high school, you went to Hampton University. We have something in common because two of my children graduated from Hampton, HU, okay? Well, the real HU is what you call it, right?
Right.
Which I'm not going to get into that. I'm not going to get into that. But after Hampton, well, you graduated summa cum laude. After Hampton, you went to Morehouse.
I actually went to Meharry for medical school.
Meharry first, and then Morehouse for
my intern year.
For your intern year. Let's talk about your residency, because you were a part of the inaugural, well, you were the inaugural resident at Tower Health in Pennsylvania.
Yes. So while I was finishing up my intern year at Morehouse and trying to figure out where I was going to complete my residency, this new program opened up in Reading, Pennsylvania. And my program director at the time had recommended it, so I went ahead and I reached out to the program director directly, and then he brought me in, me and another resident, and so we were the only two there initially.
And the first?
The first.
Wow.
Yes.
Wow. So what brought you to Savannah?
So when I was completing my residency, I wanted to get some more exposure to things I didn't necessarily see. Reading, Pennsylvania was an area that had a wealthier demographic, and then also had a lot of Hispanic demographics as well. And I wanted to see things that we didn't particularly do there. And so I came down here and I worked with Metro Surgical, which exposed me to a lot more than I had seen in residency, and I think was very pivotal in my role as a general surgeon.
Now, in my introduction, I mentioned the number of Black women surgeons, but according to the Association of Black Women Physicians, Black women make up only 2.8% of the physician workforce in total. Let's talk about what's being done to boost those numbers, and why is it important?
So it starts with exposure. So for me, it just was a personal story, and a lot of my classmates that I was at Meharry with, a lot of them had personal stories or family members who were sick and that they wanted to help, but also just kind of reaching out to the community. So I've done different projects like in undergrad and during medical school to kind of raise the awareness that you know, being a doctor is a great thing. Yes, it's a hard road to go down, but it's absolutely doable, especially if you have the support.
And that's what I was going to ask you. What advice would you give to younger people who may want to follow in your footsteps?
So definitely, you know, you can always reach out to me. So my email is saudia.mccarley@gmail.com. And so you can reach out to me regarding if you are interested in medicine and want to kind of see like what advice I could give as far as like going through undergrad and going into medical school and the steps to take there for the MCAT, etc.
Now we have a little bit more time, about 30 seconds, but let's talk about you being a general surgeon. What does that entail?
So a general surgeon is pretty much a physician that particularly does particularly abdominal cases.
Okay.
So I take out gallbladders, appendices, I do colon surgery, and I also do hernias. That's a very big one as well.
All right. Well, Dr. McCarley, all the best to you. Thank you so much for joining us, and congratulations. I mean, you are history in the making. Thank you so much.
Thank you.
Stay with us. You're watching News 3 Today at 11. We'll be right back.